This is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So here I would like to discuss with you all about 25th of February 2023 OET exam, in which as usual OET writing and OET speaking. Okay, so let's move on to the topic. There were 2 letters asked on the day of 25th of February. So the first letter was writing a refer back letter. Writing a refer back letter to the patient's GP. Another letter also was a known case letter, writing a letter to a patient's GP. Okay, so let's first discuss about a refer back letter. So what was the case note? Patient name was Elisa Dawson. She is a 41 years old lady who has a family history of heart disease, and also she is a full-time worker. Unfortunately, she has been experienced some unusual symptoms in her condition. For example, nausea, vomiting, and blood in stool, which means melena, and also weight loss. Thereby, she gone to her own GP. The GP has requested her to do some blood investigations and also an X-ray. So the both blood investigations and X-ray was normal. Apart from that, the doctor advised her to undergo for a CT scan. Unfortunately, the CT scan revealed that the patient has stage 3 bowel cancer. Thereby, patient's GP writing a letter to the oncologist specialist for the further treatment and management. As usual, patient also gone to the oncology specialist. And after she gone to the oncology specialist, they have explained to her about the 30 session of chemotherapy and regarding the importance of taking the chemotherapy, what are the side effects of chemotherapy, the importance of hydration during the chemotherapy session, and also they have orientation given about the chemotherapy ward and what are the further procedures. Apart from that, they have advised her to get into herself yoga, meditations, like that kind of things to relieve her stress during the chemotherapy session. So this all discussion has been done with the patient when she gone to the oncology specialist. Thereby, an oncology nurse is writing a refer back letter to a GP that what they have done when the GP was referred the patient to them. So that discussion was narrated by a oncology nurse to the patient's own GP, again back. So that's the letter we are writing. So it's somewhat different letter than other usual letter if you understand the case note properly. But another thing is, like, if you understand the case note properly, it's easy for us to narrate the story. So as usual, we are writing a date they have said 8th of January 2023, and then we are writing a addressing person, it's patient's GP, and then salutation, writing a reference of the patient name, and then your age or date of birth, whatever they have given in the case note. And then now your introduction. So here you are refer back. So instead of writing a refer back, you can write like this. You are just giving an information to the patient's GP about the patient's condition, that what you have done for the patient after the referral of the patient's GP to you. So I'm writing to inform you about your patient, Mrs. Elisa Dawson, who was discussed about the treatment option regarding her condition, or else who was discussed about the treatment option for her stage 3 bowel cancer, full stop. She requires your further support. Throughout her procedure or throughout her treatment. She requires your further support and discussion throughout her treatment. Like that also you can write it, or else you can write it in another way. I'm writing to update the current health condition of Mrs. Elisa Dawson, who has been who was discussed about the treatment option regarding her stage 3 bowel cancer. She requires your support and discussion throughout her procedure. Like that also you can write it. Okay, then the remaining thing, what you are writing it, don't write it that she was diagnosed with the stage 3, because it's all was done by a patient's GP. Patient GP was the one referred the patient to to the oncology specialist. So patient GP knows that whatever he was done. So only he does not know that what they have discussed with the patient and what he has to discuss with the patient further. So that is the part when we have to write it. So patient has been like Mrs. Dawson was discussed about so and so, like orientation given regarding the chemotherapy ward and chemotherapy sessions, regarding the side effects of the chemotherapy, how many cycles of chemotherapy she has to undergo, and also how to dehydrate herself during the chemotherapy sessions, and the importance of of recreational activities such as yoga, meditation, and these all are the information, the importance of the diet, and these all are the things which has been discussed with the patient, that has to be discussed by a GP also, again by giving a support and the psychological support to the patient throughout the therapy. So that all those things that you are writing it and narrating it as in a very simple way, at the same time that very important that these all points has to be included in the passage. And then you're coming to the recommendation paragraph, because you no need to write the social background of the patient, because it's we are writing a patient writing a letter to a patient GP. Recommendation paragraph, it would be greatly it would be highly beneficial if you could discuss with your patient regarding the importance of the chemotherapy sessions, and provide her support throughout the therapy in order to engage herself completely to the therapy to get a successful treatment or something like that. And then you are faithfully or sincerely based on the address, like if they have given the name of the GP, or if they're not given the name of the GP, as per the way you can write the letter. So this is the points are very important. So it's not necessary to write about all other points, because the GP was the one diagnosed the patient, and he was the one referred the patient to the oncologist for the further treatment and option. So the oncology specialist nurse writing back, which means the referring back the patient to the patient's own GP. Okay, so this was the one letter they have asked on the 25th of February. And the letter number two, writing a letter to a patient's GP. The patient is a boy baby, and he is 4 years old, who is attending a kindergarten, and he has been suffering with otitis media for the last 6 months. And apart from that, the school teacher has been observed the baby for the quite few months, and then she came to know that baby has a poor communication ability, and also lack of concentration, and also baby has a poor capture capacity, understanding capacity, lack of understanding capacity. So thereby she is writing a letter to a patient's own GP in order to find out that patient may have any intellectual disability, or patient may need a treatment for otitis media, a patient has needed treatment for the poor communication skills. So because of lack of communication skills, so for this purpose, a school teacher is writing a letter to the patient GP to know about what could be the reason behind this all intellectual development issues. And either it could be the otitis media because of the infection, or because of that any by birth speech difficulties, or any growth and development, for example poor intellectual development. So for that purpose, a nurse is writing a letter to a school teacher, writing a letter to the patient GP. So here, as usual, introduction, you can write it. I am writing to update the current condition of so and so, who is suspected to have intellectual disability, or who is suspected to have otitis media. He requires your further assessment and management. Like that you can write it. And then you are writing the present medical history, whatever the things that they have observed from the boy, that we are narrating it in a very simple and elegant way, and also it's in a like what to say, we are just writing in concise and clarity manner. And then the social background is not necessary, because we are writing a letter to the patient's own GP. And then recommendation paragraph that you can write, it would be highly appreciable, or it would be highly beneficial. Would you mind, can you do assess, diagnose, and to treat the patient as you feel appropriate. Your concern on his condition at present is immensely appreciated. Then you are writing that you are faithfully or sincerely based on the addressing person name has given or not given. Okay, so these are the two letters has been two letters were asked on the day of 25th of February exam. Okay, now coming to the speaking topic. So what are the speaking topic they have asked? So the topic number one was, it was a discussion. It was a discussion in the community health center, like a mother child, as a mother brought the baby with the fracture. So that mother is asking about the treatment option of the fracture, and asking about the cost, and what is the point of cost, and what is the benefits of cost. So these are the things, like it is resembling of the green streak fracture, which has been already done multiple times during the preparation of OET exam. Okay, and the second topic was, like, it is in the hospital ward. They are just talking about the IV cannulization. The patient who are having an IV cannula, patient don't like to have IV cannula, so the patient wished to change to IV and oral formation, tablet formation. So the nurse is as usual explaining the importance of IV antibiotics, importance of having IV cannula. The same, it's a somewhat old topic, I could say that, because these topics has been that this topic did asked in 2022 itself. Yeah. And another topic is like it's in an emergency department, a patient admitted with the RTA, so that the nurse is discussing with the patient family members regarding the treatment options and what is the problem for the patient and how the patient's condition, so current situation of the patient and the future treatment options, everything has been discussed with the patient family members in the emergency department. Another topic is like it is a private clinic where they are discussing about the chilblains, the patient who attended the clinic with the signs and symptoms of chilblains. So they are explaining about the management of chilblains and what is the options for behind options to develop the chilblains. So these are things are discussed in the clinic. And another things I could say that the last one is like community health center. Community health center, they are talking about the COPD inhale, means talking to the COPD patient regarding the importance of the usage of the inhaler. So types of inhaler, how to use it, and when to use it, and what is the benefits of using the inhalers. These are the things are discussed with the COPD patients. So these are the topics asked on the 25th of February 2023 OET exam. I hope this discussion video would help the people who are preparing for their exam and who already done with their exam. And whomever wants to join in our class, our number has given in our description. You can participate, you can join in our class anytime. We have 30 days, 40 days, 60 days, and then we have a mock batch also, 10 days classes, writing and speaking alone modules are running on. So if you wish to join in our class, you can join in our class. Our number has given in our description. We have only online classes. Okay, so until then, bye bye.